From the San Francisco Public Press, you're listening to Civic. San Francisco's Director of Public Health provided a glimmer of hope in the city's drug epidemic last May when he announced that the rate of fatal overdoses had slowed down a bit. But then he said this.
While some regions of the country may have already seen their peaks in fentanyl overdose deaths, other regions, potentially including the West Coast, may have not.
That seemed like a perfect moment to remind folks that overdose prevention centers have saved lives all over the world for more than 20 years. Instead, he suggested only treatment and recovery could solve fatal overdoses. But as I witnessed firsthand last year, the care and compassion that clients receive in an overdose prevention center can be enough to turn lives around.
Reunification with children and reunification with families and reemployment. These are things that would never happen for these folks.
I'm Sylvie Sturm, and this is Civic. Last spring, I had the fortunate opportunity to take a long vacation. And for the first time in a very long time, I truly disconnected from my coverage of San Francisco's drug and overdose epidemic. For weeks, I didn't read the news, I didn't reach out to sources, I barely even looked at email. So when I returned, I was able to view things with a fresh perspective. And that's when it struck me. This niggling thought that I couldn't shake before my holiday became crystal clear. The Public Health Department's plan for overdose prevention centers seems gone for good. It also seems like their leadership would rather we all forget the plan ever existed. This thought struck me when City Health Director Dr. Grant Colfax announced the good news in May that the overdose mortality rate had recently decreased. He also warned of more deaths to come.
While some regions of the country may have already seen their peaks in fentanyl overdose deaths, other regions, potentially including the West Coast, may have not. However, I think it's important while we continue to deal with these too high death rates, the fact that so many people are dying across the country, in the state, and of course locally here in San Francisco, the important thing to know is that there is an answer to fentanyl dependence, and that is treatment and recovery.
During a National Overdose Awareness Day event last August, Colfax announced that overdose deaths had declined slightly. The latest figures show that from January to June this year, 374 people have died of overdose in San Francisco. That's down from 405 deaths recorded during the same time in 2023, and at this rate won't reach the record-setting 810 fatalities last year. But that's still on pace to record 748 deaths, which is more than every other year since the city started recording data in 2020. That count also neglects the 1,900 overdose-related calls that were made to emergency services over those 6 months. Colfax credited the dip in overdose deaths to a new nighttime telehealth program that connects unhoused people who use drugs with 2 medication prescriptions that eases withdrawal symptoms. But with all this potential loss of life still hanging in the balance, what about overdose prevention centers? Those are places where people with substance use disorder can consume their drugs using clean supplies out of the public eye, near staff who can reverse an overdose if that happens. They can connect to housing, medical care, and hygiene and social services. And staff have the opportunity to build trust with the clients so that a pathway to treatment is available when they're ready. Some people who aren't closely familiar with substance use disorder believe that traditional, quote, rehab is the only path to health. But the fact is that overdose prevention centers have been saving lives around the globe for decades. Data shows they prevent deaths, and many public health professionals have long advocated for such facilities as a crucial harm reduction tool. Before he became the department's leader, Colfax himself was part of a decades-long campaign to open such centers in San Francisco. And it looked like the campaign worked when Colfax led the city's plan to open several sites in 2022. The plan had the backing of several city supervisors and the mayor. The city even had millions in opioid lawsuit settlement money to fund the sites, but plans were put on hold over questions of legal liability. Last year, the nonprofit organization Health Right 360 got enough private donations to open a center, which resolved those legal issues. But they needed the go-ahead from the Department of Public Health to launch its operation. The department said that despite the private funding, opening a center would be a long, arduous process since, quote, there are a number of complex legal, procurement, location, and community factors that need to be addressed. So Health Right 360 waited and waited and waited. Last July, I asked for an update from the Mayor's Office, the Department of Public Health, and city supervisors, including the ones who expressed support. But no one responded to calls or emails. I spotted Colfax at a public event last August and asked about the city's plan for overdose prevention centers.
Well, what our focus is right now is continuing to make sure that people have access to treatment. And we're seeing some hopeful signs with overdose deaths down a bit. We still have a long way to go, but I'm cautiously optimistic that we're moving in the right direction.
So it seems that some authorities just want the subject memory hold. But once you've visited an overdose prevention center, it's impossible to forget how transformative it can be, both for its clients and for the community. I briefly talked about visiting a center in New York City called OnPoint NYC during a Civic episode last November. I thought now might be a good time to share the rest of what I saw. OnPoint NYC is a nonprofit harm reduction organization operating 2 overdose prevention centers in Manhattan, one in East Harlem and one in Washington Heights. The locations opened on November 30th, 2021, with support from the City of New York. The city keeps itself safe from legal liability by funding only the wraparound services, like healthcare, social services, connection to housing, and even acupressure sessions, rather than the space where people consume substances. It was a beautiful spring afternoon in East Harlem, and I was much too early for my meeting, so I checked out the busy neighborhood around Dr. Martin Luther King Jr. Boulevard and East 125th Street. I spotted a friendly-looking guy manning a table covered in pamphlets and a huge banner that said, Harlem United.
My name is Anthony Randolph, and I'm a peer worker for Harlem United. And Harlem United is an organization that's been here for about 33 years. It started because of the HIV and AIDS epidemic. You have a medical program now that offers primary care, they offer dental, podiatry, they offer behavior health. Everything that the community needs is one-stop shopping.
I asked Randolph to tell me about the neighborhood.
125th Street is life. On the east side, it's considered part of El Barrio, which is Spanish Harlem. And Spanish Harlem consists of every race there is. It's just a melting pot of everybody. We had some great people come out of El Barrio like Tito Puente, Mark Anthony. Actually, Mark Anthony lived in my building. But you have a lot of flavor that comes out of El Barrio. You know, Spanish, West Indian, Mexican, Puerto Rican, it's all. And the culture is just a melting pot. And it's just great because we look after each other. No matter what, we look after each other.
Our conversation was a reminder that just about everyone has been touched by the drug epidemic. And you're just a couple of blocks from OnPoint NYC. Have you noticed there's been any difference at all since they've come into the neighborhood?
Yeah, they've helped a lot of people. They're getting a lot of people interested in helping themselves.
Have you noticed that there's been a problem with drug use in the streets here?
Yes, it's a big problem, especially in the black and brown communities, that it's an influx of drugs, and we're not the ones who's bringing it in, so how are they coming in? But yeah, there's a problem more now with crystal meth. There's a problem with fentanyl. I actually lost my son to a fentanyl overdose and actually had his burial service Saturday. Yeah, so fentanyl and its use, it reaches everywhere. My brother and them out in Long Island that live in a different type of community, a more up and coming community, it's rampant out there also. So it's not race-based anymore. But here in Harlem, it seems to be a twofold. It seems to be drug addiction and mental health. And then you combine them both and you have a disaster.
I'm so sorry. I'm so sorry to hear that. Do you think that a facility like the one that's over here at OnPoint, or do you think there was anything that could have helped your son?
Yes, more knowledge out in the street, because if we don't reach out to these young kids and stuff and let them know that these drugs are real and they'll kill you. HIV is real. You know, we need more supportive services, and I'm sorry to say that Our government is not providing it. Our mayor is not providing it, and our governor is not providing it. And some of us in the community is tired of this stuck on dumb looking for stupid policies that they have. You're taking money out of the community and you're taking money away from the people that need it the most. We need more programs in the community by people that live in the community and that's based in the community and has an interest in helping the community.
It was time to meet the folks at OnPoint. I kept thinking about Anthony Randolph and hoped that I was walking towards his vision. People from the community dedicated to improving the lives of those who live in the community. OnPoint has 2 entrances, one for clients and one for everyone else. As I walked through the second set of doors, I was greeted by OnPoint's communications director, Reginald Johnson. He gave me a quick rundown of the center's mission and operations. As I remarked on how polished his delivery was, he quipped,
"Yes, it's a science for us now."
That's because OnPoint had gotten a ton of attention from the media, academics, and from government officials who were considering overdose prevention centers as a solution for their city's overdose epidemics. Among them was a San Francisco delegation of elected officials, and after taking this tour, they came back extolling the virtues of such centers. They were undoubtedly influenced by Sam Rivera, OnPoint's executive director. In fact, just weeks before I met him, Rivera was named one of Time magazine's 100 most influential people of the year.
As far as I'm concerned, it shouldn't be a political issue at all, although it is right now. It's a response to a health crisis and a health emergency. The stories, all the anecdotal things around reunification with children and reunification with families and reemployment, becoming employable again and employed. These are things that would never happen for these folks. And we're just one organization operating 2. And we know there are many organizations, great harm reduction organizations, prepared to open more. And it's just like, get out of our way, right? We clean your neighborhood. When I think about what's happening in San Francisco, you want those neighborhoods clean? Offer this. This is the alternative. This is the medicine, right? In New York City, I'm sure it's close in San Francisco. In New York City, it's roughly $30,000 for the city to respond to one overdose, times 1,000 overdose interventions, right? Which we're close to. Do the math. How many millions and millions are we saving? If you're someone who says, I don't really have skin in the game around drug users, etc., I'm sure you have around taxes and costs, right? So it's clear. And if that doesn't shift people to support and move us into place to open more, then it's a different issue. Then you have bias and some pretty strong feelings about drug users and what they look like. You're not a humanitarian.
The next stop on my tour was the health clinic. There I met Susan Spratt, Associate Director of Clinical Services, sitting at a small desk in an examination room next to an elevated bed.
So what kind of services do you provide?
We provide an array of services. First and foremost, we're here to sort of provide wound care for folks. We do a lot of testing and treatment of Hep C. And also we provide Suboxone or buprenorphine. So those are the 3 sort of the biggest things that we do. And then we provide services for lots of different things. For a lot of people, they come to us and they're not connected to primary care. So we end up doing what we call bridge care. If somebody comes in and they say, I've run out of insulin and I don't have an appointment with my primary care doctor for another few weeks, is it possible for you to help with that? We can provide that, and we do make sure that that person is then linked, make sure that they have an appointment and help them, even in some cases escort them to the appointment. Because of our location next door to the drop-in center and the connection to the OPC, we're all on the same floor. A lot of our folks are people who come and use our services every single day. Our first OnPoint staff doctor, Dr. Mike Pappas, he is very connected with our participants, and so they feel comfortable walking over and saying, hey, I was in the hospital. I have an infection in my finger. I think they discharged me too early. Can you take a look at it? Then it's people saying, I haven't been able to make it to my psych. Can you call a trusted psychiatric practice? Because of that relationship that we have with many of our participants, they come in and that sometimes they just need to have a conversation. They just want to connect. They see this as their community. It is their community. And then they also see us as trusted people they can just talk to, get things off their chest.
Why do you do this work?
I started this work as a volunteer. Drug misuse is something that has touched my family and people that are close to me. And so I just was interested in understanding more about that, and just ended up in a position where I sort of fell in love with the participants, with the community here, and just as a whole. So I just keep coming back. It's a great place to work. This work can be difficult sometimes because you're trying to reach people with a lot of competing priorities. You know, obviously there are people with myriad needs, and, you know, you're trying to meet them as best you can, but much of the time it's difficult. At the same time, this has been said to me more than once, to me and to multiple staff members in our clinic. You know, I feel like you're really listening to me, or I haven't been listened to in a long time, so thank you. I haven't been heard. I haven't been seen. And I think that is what is informing our work fundamentally, is we're listening to people who haven't been listened to for a very long time. We're seeing people who are often not seen. They're stepped over, literally walked by in the street, passed by. And that's something that we're trying to upend.
The next person I met on the tour embodied that sentiment wholeheartedly. Juan Cortez is the manager of OnPoint's Holistic Healing Center. The space is a serene, dimly lit, spa-like setting on the second floor that offers various treatments, including Reiki and acupuncture. The only sound you might hear is the low rumble of a gong used for sound therapy.
This beautiful sanctuary set up for people that normally would never dream of receiving such services. Most people associate things like massage therapy and acupuncture sound therapy and Reiki and things like yoga and Tai Chi with like a spa day. So what we do is we provide a space for people to come here, and we call it a sanctuary. And the main ingredient is love. So when people come through the door, they're met by love. And then the healing process begins. The services are provided by staff that some have life experience, and also community members that come and volunteer their time. Licensed massage therapists, licensed acupuncturists. We got a chiropractor that comes through. But what we do came at a very, very high price. People lost their lives and people lost their freedom so we could do this work. Today, people are still dying. They're dying from the opiate crisis. They're dying from lack of health care.
Cortez talked about harm reduction, which I've covered extensively in previous episodes of Civic. Proponents believe that eradicating substance use is unrealistic, and many of the measures taken to achieve the goal are inhumane. Their strategies instead aim to reduce ill effects on personal health and society as a whole. Cortez provided some historical context of the harm reduction movement in New York City.
The particular type of treatment that we do here the most is called the 5-point protocol, or NADA, based out of the National Acupuncture Detoxification Association. But it goes back to the late 60s, early 70s, and also to the 80s with the harm reduction. Everybody knows about the HIV epidemic and how the first syringe exchange were legalized, and now we have the first legalized OPC in the country, right? But what people don't know is that the acupuncture component, the holistic part, that seeing the mind, body, and spirit that we practice here and is so effective, came from a group of young activists in the South Bronx. It stemmed from the movement of Lincoln Detox. At that particular time, there was no holistic approach to substance use. There was a huge opiate epidemic. People were dying from overdoses. Remember, the drugs were being flooded into the communities. And the only available treatment was methadone. So people were forced on a methadone program, whether they needed it or not. Detox didn't exist. Lincoln Hospital in the South Bronx was called the butcher shop because people would literally die in the emergency room waiting to be seen by a doctor. The building itself was condemned, but it was kept open for poor people. So the young lords went inside the hospital and they took it over without disrupting services to bring awareness of the conditions in the South Bronx and the conditions on healthcare in those communities. And they made some demands. One of those demands that they demanded a detox clinic, and they demanded a new hospital. They demanded free child care for working parents, which we still hear about today. The patient bill of rights that people get when they go to the hospital, they fought for that. The city agreed to do a detox program, and they had radical doctors that were working with them, helping people to get off methadone and wind down. But they knew that they needed to do something else, so they happened to read an article about somebody that was an opiate smoker and was receiving acupuncture, but the person detoxed while getting acupuncture. So they said, why not do this here? But remember, these are a bunch of 18, 19, and 20-year-olds from the South Bronx. They know nothing of acupuncture. They started to read books, they started to learn points, and eventually they got an acupuncturist to show them one needle, the lung point. That grew to Lincoln Detox, where they were detoxing people using acupuncture, and they were educating them on their rights to be treated as human beings.
Can you talk about the transformational effect that you've seen from the clients that come through here?
Success to me is when they walk through the door, and the healing begins at hello. You could come here through any given day and see the people that are in this room, and you see the way that they're loved and treated and the way they come out of this room, and you see that there's a transformation there, because we meet them in the streets and we engage them in the streets, we get them into the drop, and they go inside the OPC. And then when they walk through these doors and they see the spa setting in Harlem, first of all, the word that comes out of their mouth is wow. You know, and like, this is for me. The transformation also comes from like the staff. Some of us come from the street where we were treated the same, and because of these services, now we're providing the services. We have a training program where we teach people Reiki. You know, we teach people how to do the same protocol and get them to go out and serve their community. And that's what it's all about. It's about giving people tools, giving people opportunities. But most importantly is love. And the needles, they're just an extension of that love.
Heading back downstairs to the waiting area was a shock to the senses after the serenity of the healing center. The space was large enough to accommodate 40 people, and it was nearly filled to capacity, echoing with boisterous, mostly cheerful voices. At the back of the room, through a set of doors, was the supervised consumption part of the center. The City of New York doesn't directly fund this service since it's illegal. Private donations support it. It's a large space with a desk in the middle, neatly lined with bins full of clean supplies for consuming substances. Along the walls were empty cubicles ready for use. There I met overdose prevention specialist Race Samuelson.
Welcome to the Overdose Prevention Center here. So we don't provide any drugs, anything like that. We're just a safe place for people to come in, be monitored, and have safe supplies to use. The flow of things, people come on in the room, they wash their hands first at the back, the hand washing station with foot pedals. So once we've cleaned our hands, we're not touching anything dirty again. Reduce transmission of bacteria, cleaning off injection sites, just wanted people to be the healthiest they can. We have 8 booths here for our injection users, our sniffers. They could use a booth area. They're equipped with a high-powered light helping you find a vein, a big mirror that allows our participants to see themselves, do their hair, do their makeup. Also, our participants to see behind them and feel safe, specifically our female participants who are used to, looking over their shoulder in the street when they are using. And then for us, we're able to monitor everybody through the mirrors, look for signs of overdose. So we want to give people the privacy to do a really intimate thing while also making sure we can monitor everyone and make sure everybody is safe. So everybody in here right now has a paperwork on them telling me where they are, what drugs they're using, and how they're using them. We're a polymodality site, so we allow people to use whatever drugs they want in whatever way, shape, or form they want to use them. If they want to time the smoking room and then an injection, then a sniffing, we allow that to happen. We just kind of want to have a game plan. So if there is an overdose, we can see what drugs were intended for consumption, and that might change what our overdose intervention might look like.
How did you come to this job?
I started in harm reduction about 4 or 5 years ago after a friend of mine passed away from a heroin overdose. Just with all that grief, I thought, if somebody had Narcan, I knew what that was, but I knew if somebody's with him with Narcan, he'd still be alive today. So I just started volunteering at my local syringe exchange and ended up at OnPoint, just working as a harm reduction specialist.
How often do you see overdoses?
We see overdoses every day. Really depends. We're in an ever-evolving drug epidemic, so really the drug supply is changing on a week-by-week basis. We're in New York are seeing some of the highest concentration of fentanyl, so even over the last year and a half of being here, I've seen overdoses come a lot quicker. Those overdoses where people stop breathing happening a lot quicker, maybe when the needle's still in the arm, and so we've adjusted our overdose protocol. So for example, I'll draw up extra naloxone syringes at the beginning of the day, prepping to see more overdoses. I'll reduce the flow of participants into the room because I'm expecting more overdoses. If there's a specific bag that we're seeing, a stamped bag that we're seeing more than 2 overdoses on, we're going to hold it. We're going to use our drug testing services to check it and see what's in it. But also every person that comes in with that bag, we're going to say, hey, watch out. We've already seen a couple overdoses with this. Why don't you split it in half what you're going to do? Why don't you start small? Why don't you tell us when you get it in? And this way we're able to respond to the changing drug epidemic. Today, I think we haven't seen an overdose yet. It's been a little bit of a slow day. I think we see between 1 to 3 a day, sometimes 5, sometimes 8, but it really changes.
Are you ever disturbed by the fact that there are these dangerous drug poisonings basically happening out there? Does it anger you ever? Or?
What angers me is when people don't know what they're consuming. So when you're saying poisoning, that's what I think of, when people don't know what they're consuming. I had buddies in college who were doing a line of cocaine and overdosed and died. You know, they didn't know that they were using fentanyl. They didn't know they were using opiates. So what I really want is for people to know what they're using and to break down the stigma of using drugs, to allow people to access services, using fentanyl test strips, talking to your friends about, you know, I am using right now, and what are the services you can use to keep yourself safe.
Do you ever get the impact, the emotional impact of you're saving lives every day? Does it ever hit you that you're saving so many people from the grief of losing a loved one? You're saving somebody who could go on to do amazing things for the rest of their lives. Do you ever really take that in sometimes?
I try to sometimes. It's easier said than done. I think we're just so used to just going all the time that sometimes we don't have the time to just stop and reflect on it. And then it happens at the most unopportune times when I wasn't expecting it, and it definitely hits. So most definitely, when I see a person I haven't seen in a really long time, when somebody stops coming, it's bittersweet. It could be really good for them. It also could be really negative for them. So I've seen that the way that we measure success, it's not linear. Success means different things for different people. So for some people, I've reversed their overdoses. I've called detox. I've sent them to detox. I've seen them having over a year clean, now coming to join our facility and volunteer and give back. So that's a big success. I've also seen people get housing, and just because they're not sleeping on the street, their use has gone down exponentially because they're not sleeping on the cold concrete. So he's still using, but that's a big, big success. Sometimes a success is giving somebody a shower, giving somebody a cup of water, giving somebody a hug. So I think for me, I try and just stay in the day-to-day and what I could do today.
OnPoint NYC is now lobbying to access some of the state's $335 million in opioid settlement money, and they're highlighting key achievements to support their case. First, center officials say they've intervened in more than 1,500 overdoses with 0 deaths since operations began nearly 3 years ago. The facilities also help transform neighborhood parks from areas full of used needles into places enjoyed by the entire community. A study published last April in the New England Journal of Medicine found that the centers keep people alive and keep them from consuming drugs in public. And finally, another 2022 study found that the centers did not increase crimes recorded by police or calls for emergency services in the surrounding Manhattan neighborhoods. It seems like OnPoint's success may be paving the way for others. Last April, a nonprofit called Minnesota Overdose Awareness opened a safe injection site in Minneapolis. The center was allowed to open thanks to legislation signed in 2023 by Minnesota Governor Tim Walz, who happens to be presidential candidate Kamala Harris's running mate. Also, in Vermont last June, the legislature overrode the governor's veto of a bill to sanction an overdose prevention center in Burlington, an addiction hotspot in the state. And last February, the Providence City Council in Rhode Island approved a state-sanctioned overdose prevention center. Officials hope the center can open later this year. The operators of that center say they hope it encourages other elected representatives to back the strategy in their towns. I'm Sylvie Sturm, and you've been listening to Civic. Civic comes to you from KSFP LP 102.5 FM in San Francisco, a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find the accompanying article for this episode and all our reporting at sfpublicpress.org. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes producer Leanna Wilcox, KSFP Program Director Mel Baker, and Executive Director Lila LaHood. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on KSFP. New episodes on Thursdays. Find everything going on with Civic and the San Francisco Public Press by signing up for our newsletter at sfpublicpress.org/newsletter. Thanks for listening.